Hi everyone, my name's Fiona McKay and I'm an Associate Professor at Deakin University in the School of Health and Social Development. I'm going to talk to you today about my research into food security and hunger during pregnancy. So across the past decade, our research has traced a simple but profound truth. The ability to nourish oneself during pregnancy is shaped far more by systems, structures and social conditions than by individual choice. What began for me as a small qualitative inquiry into how women navigate food insecurity has grown into a rich and interconnected body of evidence revealing the lived realities of pregnant and postpartum women, particularly migrant women, low-income families and parents of young children across Australia and in other high-income countries. To understand the relationship and the impact of food insecurity on health outcomes, we need to employ a life course framework. Exposure to food insecurity at one point in time can predispose an individual to poor health outcomes at a later point, but severity and duration of food insecurity also needs to be taken into consideration. What might be even more important is the timing and the level of stress caused by food insecurity and the interaction with the food environment. So we focus our work on preconception, pregnancy, and postpartum. We've listened to migrant women describe the cultural food practices that sustain them, the traditions they carry across borders, and the challenges they face when those traditions collide with unfamiliar food environments. We've heard women speak candidly about the stress of not knowing where their next meal will come from and the quiet and creative strategies they use to stretch their limited resources, strategies that often remain invisible to healthcare professionals. Our work has shown that food insecurity is not an abstract concept. It's a daily negotiation that shapes maternal well-being and infant health and family stability. In my work, I've always started with a simple question. What does food insecurity actually feel like for the women and families living it? Understanding these experiences has been central to my research. Women are an under-researched group and their voices are too often missing from policy, practice, and even academic conversation. So I've made it a priority to ensure their stories, their cultural knowledge, and their realities sit at the centre of my work. Across my work, a clear and powerful picture has emerged. Food insecurity, cultural food practices, and structural barriers profoundly shape the nutrition, well-being, and healthcare experiences of pregnant and postpartum women. We see the inequalities faced by migrant women, low-income families, and parents of young children, and how cultural traditions limit access to nutritious food and complex welfare systems intersect to influence maternal health. We hear women describe their daily struggles and the things that they do to manage food insecurity, and we learn that not only do they expect food insecurity to be addressed in antenatal care, they value it, they benefit from it. This body of work has shown that brief screening tools are both feasible and acceptable in antenatal settings. It's identified predictors of food insecurity during pregnancy and mapped the systemic barriers that limit access to care. Most importantly, it shifted the field. These findings now inform clinical practice, guide policy reform, and strengthen public health responses aimed at improving nutrition equity for pregnant women and families. In short, this research is helping us move from recognising food insecurity as a problem to designing systems that actually respond to it. Building on this work, I've also engaged with the healthcare system to explore the ways that food insecurity can be identified and addressed within the healthcare system. This work has engaged healthcare workers and leadership. The work has advanced our understanding of how to support maternal nutrition in ways that are both culturally meaningful and evidence-based. This research demonstrates that nutrition education during pregnancy is often fragmented, culturally mismatched, and inconsistently delivered, yet profoundly influential for maternal and infant outcomes. By mapping the global landscape of nutrition education during pregnancy, my work has highlighted the gap in current practices and the urgent need for approaches that recognise women's diverse cultural identities. Studies exploring healthcare professionals' perceptions of migrant women's food practices reveal the disconnect that can arise when cultural knowledge is absent and the opportunities that emerge when clinicians engage with women's traditions respectfully. Our work in co-designing a culturally tailored nutrition research for migrant women during pregnancy shows how meaningful collaboration with migrant women and healthcare providers as equal partners produces tools that not only are relevant but are empowering. My work seeking consensus through Delphi methods provides clear guidelines on how antenatal services can screen and support women effectively. Complementing this is a review of interventions addressing food insecurity in pregnant women and new mothers, which provides clear evidence of what works, what does not work, and where innovation is most needed. Collectively, this body of work shifts maternal nutrition from narrow clinical focus to a broader equity-driven agenda, one that centres culture, lived experience, and the structural realities of life to improve outcomes for women and families. My research has also engaged the emergency and community food sector. This sector is the main way that food insecurity is addressed in countries like Australia, and as such, exploring the role of this sector for people who are experiencing food insecurity has been essential. With my work, I've sought to make the visible, often hidden realities of poverty, stigma, and coping among families who rely on charitable food support. I've documented how parents navigate hunger, stretch limited resources, and engage in acts of reciprocity with their communities. And I've sought to reframe how food insecurity has a social and relational experience rather than simply a matter of supply. I've explored stigma and the constraints of the charitable food system, highlighted how shame, limited choice, and structural inequality shaped people's interaction with food banks. While my investigation into household coping strategies revealed the ingenuity and resilience required to survive on inadequate incomes. This work has challenged assumptions about charity-based food relief, informed more dignified, client-centred models of support, and strengthened public policy conversations about the need for systemic solutions beyond emergency food aid. So what does it all mean? Food insecurity during pregnancy is burdensome, relentless, and it undermines wellbeing. We need to screen food insecurity during pregnancy because we need to know how many pregnant women are impacted. We need to find a way to respond to food insecurity during pregnancy, and this needs to be evidence-based and accessible. And we need to continue to advocate for an increase in welfare because we know that food insecurity is linked to poverty, and poverty is about money. Together, this integrated body of work reframes maternal nutrition and food insecurity as interconnected issues rooted in social justice. It bridges households, communities, and health systems. It amplifies the voices of women and families and offers practical, culturally safe, and system-level solutions. Ultimately, my research shifts the conversation from temporary food relief to structural change, from fragmented antenatal nutrition advice to culturally grounded care, and from hidden hunger to a public health agenda centred on dignity, equity, and the right to be nourished. So that's it for me. Please feel free to get in touch if you've got any questions, and thank you for listening.